Hi, I'm Elijah. I'm a student physical therapist today. I'm going to be helping you out. Can I have your name and date of birth, please?
Jamie Ike, 01/14/2000.
Okay, thank you. So, what brings you in today?
So it started to get a little warm outside, so I decided to do some more cardio and lifting. But I've been experiencing some pain on the outside of my right knee, like once I'm done working out or done doing cardio.
Okay, so with the knee pain, can you recall anything that may have happened, such as like maybe you fell off a bike or anything like that? You got hit in the knee, or is it something that kind of just like gradually came on?
Just gradually came on.
Gradually came on. Okay. And so you said it hurts when you work out and stuff like that?
Yes.
Okay, so is it more like does it hurt all the time when you're working out, or is it more like when you do exercise with your legs or something like that?
More like exercise with my leg and cardio.
Cardio? Okay. So is there a specific type of cardio that hurts it?
Running on the treadmill or like stair stepper.
Okay. And then how do you feel if you were to get on a bike and go all the way around with it?
It kind of hurts on the bike,
Okay.
but not as bad as
Not
a
as
stair
bad.
stepper.
Okay. And like, is there any certain exercises that cause the pain?
Anything that really has to do with working my legs.
Okay, so like squatting,
Yeah.
leg press?
Leg press.
Leg press a lot?
Yeah.
Okay. So right now, currently, how does that pain feel right now?
It's more like on a scale of 1 to 10, more like a 2.
A 2?
Yeah.
Okay.
1 or 2.
So is it like a deep, achy pain, or is it more like a sharp pain?
It's more of like a deep achy pain.
Deep, achy pain?
Yeah.
Okay. And at its best, so like when whatever you're doing, when it's at its very best, 0 out of 10, 0 being no pain at all, 10 being I need to go to the ER, what's your pain at?
2.
2?
Mm-hmm.
So like right now?
Yeah.
Okay. And is that usually when you're like, is it just when you're like resting, doing nothing, just kind of like relaxing at home?
Yeah.
Okay. And then what about at its worst? What does it get to?
More of like a 7.
7?
Yeah.
Okay, and that's with the leg exercise and everything like
Yes.
that, correct? Okay. And so before we move on, like, what do you do for a career? Like, are you on your feet a lot? Are you bent over? Are you on your knees a lot? Like doing something like this, such as like this, or say you're maybe working on something like mechanical or something that would cause you to be on your knees a lot, or are you standing up a lot?
Kind of both.
Kind of both?
I'm a dental assistant, so
Okay.
I sit in a chair and I end up walking sometimes.
Okay. So do you have that pain with your occupation, or is it more just like exercise?
More exercises.
Okay. And so say you had a hard exercise with a lot of legs or maybe cardio. The next day, how do you usually feel when you wake up? It's pretty sore?
Yeah, it's pretty like achy
Pretty
in the morning.
achy?
Yeah.
Okay. Well, we're gonna do some tests and everything, but first we're just gonna check a few things just to be sure, and then we will get started and try to figure this out. Okay?
Okay.
All right. So can I have you stand up, please? All right. So I'm gonna put my fist behind you. I'm just have you bend over behind it and try to bend around my fist. Okay? As far as you can. Good. Good. Okay. Now I put my hand right here. Do you mind if I put my hand on your belly? Okay. Go ahead and go forward. Good. Okay. Now put your hands to your side, and you're gonna go down and try to like touch your knee. Anything?
No.
Okay. Now the other side. Anything?
No.
Okay. Go ahead and go forward again. Just gonna press you a little bit. Anything?
No.
Okay. Now go to this side. Anything?
No.
Okay. Now this side. Anything?
No.
Good. All right, I'm gonna test your reflexes real quick, if you don't mind. So, I'm just gonna test 2 today, okay?
Okay.
So I'm gonna have you look that way, take your hands like this, and you're gonna pull, okay? And then look that way. Okay. I'm gonna come to the other side. You wanna look to your right, please? Do you mind if I remove your shoe?
Yep.
with the other one as well, if you don't mind. All right, go ahead and do the same thing. Okay. 3 for 3. There we go. All right, checks out right there. Okay, so now we're just gonna test to see if it's because you've been starting to run and everything, and exercise a little more. Before we start that, were you exercising pretty often before this?
Not really.
Not so
no.
much, so it kind of just like, you kind of just jumped into it.
Yeah.
Okay, so we're gonna test your muscle strength, and we're just gonna see how you sit right now. And because you kind of jumped into it, it could be a muscular issue. You could have some sort of strain or something. We're gonna test your muscles, see how you're doing, and we'll go from there, okay? All right, can I have you kick your leg all the way out? Good. Go back down, come halfway, and don't let me press you down. Put my hand behind you, I'm just gonna support you, okay? Don't let me press you all the way in. Any pain with that?
No.
Good. Come to this side. Do the same thing for me, please. Good. All right, I'm gonna support you. Come halfway. Don't let me press you down. Good. Any pain?
No.
Okay. And you're getting all the pain on this side, correct?
Yes.
Okay, just want to make sure we're on the right page. All right, so now this time, I'm gonna have you lay on your side, okay? You can face this way. All right, so can I have you straighten your legs? Yep. So what I'm gonna do is I'm gonna press my hand on your hip, I'm gonna press it forward to make sure it's stable, and I'm gonna have you raise this leg all the way up, okay? Go ahead and raise that leg up. Good. I come back down. Let's move out this way. Can you do it again, please? Good. I go down. Can you meet me halfway and not let me press you down, okay? Good. All right, can I have you lay on your stomach real quick? Can I have you kick this leg out? Or sorry, not kick that leg. Bring it, bend it up like this. Good. Now go all the way down. Meet me halfway. Don't let me pull you down, okay? Good. Again on this side, please. Good. Do you have pain with either one of those?
No.
Okay. Now can I have you lay on your side facing towards this way? So we're going to do the same thing on this side as we did over there. I'm going to have you raise that leg up. I'm going to put my hand on your hip and stabilize. Go ahead, go down. Yeah, a little bit. There you go. Now go ahead and do it. Good. Now meet me halfway. Don't let me press it down. Good. All right. Okay, you can sit up. Do you have any pain with any of those?
No.
No pain at all? Okay. And when I do these next few things, if you don't mind, if you do have any pain, let me know what kind of pain it is. If it's the pain that you've been having, so the pain out here, or if it's a different type of, it's still painful, but it's something else. Like if it's more inside your knee or anything like that. And when you're exercising, does the pain usually localize to this area, or does it kind of spread?
It's usually just this like area.
Just right there. Okay, good. So we're just gonna do a few special tests, kind of see where we're at with it, and then we'll go from there. Okay.
Okay.
All right. Right now, I'm just gonna kind of feel around your knee. Let me know if you have any tenderness or anything like that. I'm gonna start with the non-affected leg, just to kind of see. So, just gonna follow this joint line of your knee. Do you have any pain over here? I know it's on the other leg, but just making sure. Okay. Any pain out here?
No.
No? Okay. All right. What about that a little bit, if you don't mind? All right. I'm gonna feel this leg now. Let me know if you get any pain. Anything on the inside of that knee? No? Okay. Anything in here?
It's a little tender.
Little tender right there? Okay. Alright. So I'm gonna have you lay on your back real quick. Alright, so I'm gonna have you bend your leg right about there. Alright, this is gonna be a little weird. I'm gonna have to sit on your foot, okay? Just get a little stabilization. Go ahead and relax that leg for me. Very stable. So your ACL is intact. I'm just gonna press down now. Okay. Go ahead and relax that. All right, I'm going to do another test. Just let me know if you feel any pain anywhere, and if it recreates the pain, just let me know if it's the pain or something different, okay? So first, this one, I'm going to press on your ankle. I'm gonna press it out and the inside of your knee in. It seems like you're kind of tender out here, so it might hurt where my hand is, but tell me if the actual pressure in the inside of your knee hurts right now, okay? Anything? All right. Nothing with that?
No.
Okay. Now we're gonna do the opposite. Anything with that?
Yeah, it's pain on the outside right here.
Pain out there?
Yeah.
Is it about the same as the usual pain you get?
Yeah.
Okay. All right. Well, we're going to have you come to the edge of the bed real quick, but face that way. Sorry, lay on your side. Come towards the edge of the bed, towards me. Don't worry, you won't fall, I got you. All right. So let me know if you have any pain with this. I'm gonna, again, put my hand on your hip, stabilize, and then I'm just gonna raise your leg up, okay? And we're gonna see if you have any pain with it. Ooh, you look a little tight. Is there any pain in this region?
No, it's just a little tight.
A little tight?
Yeah.
Do you feel like a stretch or anything like that?
Kinda.
Yeah? Okay. Can you point to where that, like where you feel that at?
More of like here.
In here?
Yeah.
Okay. Do you feel it up here at all?
A little.
A little bit more down here?
Mhm.
Okay. Alright, well I'm gonna bend your knee. I'm gonna do the same thing. Let me know if it feels any better or about the same.
About the same.
About the same?
Mhm.
So you feel that pain right here?
Yeah.
Okay. So this next one, I'm gonna bend your knee about the same as I did right there. I'm just gonna apply a little pressure right here, okay?
Okay.
It shouldn't be enough to hurt, but I'm gonna then straighten your leg and let me know if you have any changes, okay? Anything?
It's a little tender.
A little tender?
Mhm.
Okay. Right there?
Yeah.
I'm sorry, I can see you had some facial expression changes. It looked like you might have been in a little pain. All right, so what's going on, I think, today is you kind of jumped into the exercise, and because of that, you're starting to get a little overuse out here with your IT band. It's a big fibrous band that runs along the side of your leg and it does a bunch of stuff, but a lot of stabilization. And a lot of people, were you a runner in the past?
Kind of. But
Okay.
wasn't doing much as I am now.
Okay, and did you ever have pain with that back in the day?
Not really.
Not
no.
really, okay. So because of the kind of you used to be a runner and then you stopped and then you got back into it, I think you may have jumped into it a little too much too soon. Because of that, you're getting some overuse injury right here. It's called IT band friction syndrome. So your IT band runs from up here all the way down to your knee. It's really long. And it's very common with people who are they like to run, they like to bike, stuff like that. They tend to overuse this and it becomes super tight and it can cause pain. You get any clicking or anything down here?
Kinda, yeah.
A little bit when you go like downstairs and stuff, I assume?
Yes, downstairs stuff.
You get like the click, okay.
Yeah.
Anything with running?
Not kind of, but not much.
Not much, just every once in a while, it's on and
Yeah.
off, okay. And it's just right along here then, okay?
Yeah.
Alright, so, well, like I said, what I was thinking, it's IT band friction syndrome. So, with what I did, you had a few positives, and they were positive for the pain that you were having. So, with that, there's a lot of things we can do, but more or less, we just kind of need to lower the intensity of your exercise, and then we need to do some stretching and foam rolling. It's going to be the foam rolling on that aspect of your leg is going to be really sore and tender, but it can help. It can help break up some adhesions in this area and kind of loosen that up. So before you run, you need to do a lot of stretching, okay? I'm going to show you a few stretches you can do that can help to stretch that out, all right?
Okay.
So the first one, I'm going to have you lay on your side. It's going to be exactly like what we did with one of the tests, is we're just going to I'm going to stabilize your hip.
Mm-hmm.
You're going to do, I can't be here to help stabilize your hip. You're just going to let this leg hang off the side, okay? Yeah, you can grab the side of the table and you just let that hang. Do you feel a stretch back here?
Yes.
Right along this side?
Mm-hmm.
Okay. So just make sure you're safe and you're comfortable on the side of a bed. Something that you can hang on to and so you don't fall off or anything like that.
Okay.
But you really want to hit that big stretch right here in that muscle, or the band, okay?
Okay.
Another one is, can I have you lay on your back? I'll have you bend this leg up, and then you'll bring this leg around, like that, and now reach your hands underneath, and pull this leg up. And just pull like that, and you should feel a big stretch right through here. Okay. Go ahead and relax. So do some of that. You can sit up again if you want. Just do those stretches before you run, before you go to bed, stuff like that. Do them for about like 3 to 5 reps for anywhere between 30 seconds and a minute, okay?
Okay.
It's gonna be a long, painful hold, but in the long run it'll help. But you need to really stretch that out. And then also, before, after your runs, if you have a foam roller or even like a lacrosse ball, you can set it right on your hip and work and just lay it up there, and then you can move it down all the way down the whole aspect of the leg, so it goes all the way down. So you can start at your hip and go down, start your knee, go up, either way. But when you're doing that or foam rolling, just work that whole aspect of that leg, okay?
Okay.
And then just work on stretching. And we're just gonna get you a nice home exercise program to help strengthen your legs without overdoing it, strengthen your quads, your hamstrings, all around. Just kind of strengthen everything, help with stability, and help relieve some of that stress that you're putting on that muscle to keep your knee locked, okay?
Okay.
All right, well, thank you very much, and we'll hope to get you feeling better.
Thank you.